Thank you for joining us this afternoon. I thank our panelists as well for making the long trek here and to celebrate the launch of the UCLA Center for World Health. The UCLA Center for World Health is a joint venture of the David Geffen School of Medicine and the UCLA Health System. We chose the name World deliberately. And many academic institutions, including ours, is very interested and invested in global health. Global has a connotation of referring to low and middle income countries. We're definitely interested in low and middle income countries and the problems of low and middle income countries. But one of the things that we're going to hear about today is the fact that there is a transition going on in the world, and it's been going on for the last 20 years, and we're hopeful over the next 20 years that that transition can be pushed further. So it gets harder and harder to talk about global. It gets more and more important to talk about world. And as we're all well aware, from any of the cities in which we come from, and certainly this is true of Los Angeles, one of the biggest hallmarks of our cities is the expanse between the great wealth that might exist here on the west side of Los Angeles and the great poverty that might exist 10 or 15 or 20 miles away. So we decided to call ourselves World Health because we're interested in the health of the entire world. Now, I told Dr. Horton that I was going to give him some grief because after we came out with World Health, I saw an announcement from the Lancet that said that they were launching an initiative on planetary health. You know, Richard is always a step ahead of everyone else. So I'm pleased to announce today that we've engaged the services of Elon Musk and Sir Richard Branson, and we're going to go for intergalactic health. We think that the future of the world lies in its people. And so we've decided that our mission is investing in people. Now let me talk very, very briefly about what we're about. So we've defined our values. We're humanists. We advocate for human rights, and that's the foundation of everything that we do. We're worldwide. We're interested in lower, middle, and upper income worlds and regions and reducing the disparity between them. We're interested in sustainability, and sustainability has been a watchword of development ever since it started. But we think that the sustainable impact comes from the people. And it's going to be the people on the ground in Nicaragua, in Guatemala, in Brazil, in South Africa, in Malawi, in Mozambique, in China, in Vietnam. We're going to make the difference there. And our job is to support those people and make them and help them do the best job they can do. We like to share. We love diversity. I had the opportunity a couple of Saturdays ago to speak to our incoming class of medical students. And at least half are foreign born. At least half were born outside the country. And I would say 60 to 70% indicated that they speak a language other than English at home. We like that. We think diversity is important because it's in diversity that we all grow and learn. We're horizontal. We pose questions, we communicate in ways that are conversational and inclusive, not didactic or hierarchical. And you'll hear today about one of the problems in development that often it's top down. And of course, we're innovative because we need innovative solutions to make sure that we make a difference. We've defined our priority programs, the Global Health Education programs, which is to guide and sustain leaders. And we attempt to make it inclusive to include our students, our residents, our faculty here, but also resident students and faculty from other countries. We have about 200 visiting medical students a year from other countries, and we've had an increasing number of faculty and residents coming in. Transformative scientific solutions for global health programs. We need new scientific solutions. We are an academic institution. We pride ourselves in science. International clinical initiatives strengthening human capital. That is, strengthening the human capital on the ground. World health policy for real-world impact, fulfilling the potential of science to make a difference, and technology solutions for connecting worldwide. I think you all remember that scene in Up in the Air, and George Clooney got his 10 million mile card. I got a 3 million mile card from United Airlines, and my flying has declined quite a bit. And a friend of mine sent me a headline that said, United stock plummets by 75%. And he said, it's all your fault. A lot of us who have been involved in World Health have traveled the world. It's been a privilege, but we can use technology to connect us. I'd like now to introduce Dr. Tom Rosenthal, who is the co-director of the UCLA Center for World Health. Dr. Rosenthal is the Chief Medical Officer of UCLA Health and the CEO of the UCLA Medical Group. And I want to emphasize the fact that this is really a collaboration that brings together the assets of the medical school and the health system. Dr. Rosenthal.
Thank you, Tom. Ladies and gentlemen, I can't tell you how excited I am to be here and to be able to share a few minutes with you this afternoon to kick off this inaugural event of the center. Before I say anything else, though, I would like to take just a moment to acknowledge and then to have all of us acknowledge the remarkable leadership of Dr. Tom Coates, who as the director of this UCLA Center for World Health has guided us to this day of celebration. Tom's more than brilliant, as most of you know. He's an effective relationship builder and a generous collaborator. So please, if we could. And I could sit down now and be done, but I do have one or two more things to say. Tom asked me to comment in particular about the value of the Center for World Health to the health system. That is to say, the business side of the house, if you will. We were fortunate in the planning of the center that we had Dr. Gene Washington's vision. Gene Washington, of course, is our Dean and Vice Chancellor for Health Affairs. That any international business strategy should be built on strong relationships with a small number of high-quality institutions in targeted geographies so that we could focus our efforts. And most importantly, that we build those on UCLA's greatest strength, which is our academic excellence. We're here because of our academics. The business work is a side benefit of being a great academic institution. The tangible evidence of Gene's wisdom came literally just last week when we signed our first joint venture agreement between the UCLA Department of Pathology and a company called Center Testing International, which is a publicly traded corporation in China, to establish a reference laboratory in Shanghai, China. This wouldn't have been possible without a many-year academic relationship that the School of Medicine has had with the second affiliated hospital of Zhejiang University and a number of very groundbreaking academic services, including telepathology, resident interchanges, faculty interchanges, and a variety of other very significant academic endeavors. So we believe that the business is secondary to academics and that the academics are what will carry the day. We also hope that this experience with the establishment of this laboratory will be the first of many, which will not just enhance UCLA's national reputation, but our international reputation. I'll echo what Tom was saying. What makes the UCLA Center for World Health unique, and I believe uniquely powerful, is the total integration of these business goals with our research and educational initiatives, as well as our goals and initiatives in what would Tom describe as more classic global health. The founding vision of the center was to bring the School of Medicine together so that we can be good partners with the rest of the campus, with the mission of improving the health of people and communities throughout the world through education, research, and service. The health system is proud to be a partner in all of this work of the center. So Tom, with that, thank you for the opportunity this afternoon. I really appreciate it, and I'll turn it back over to you.